Jesse, and this is the male straight catheter with specimen collection. First, I will check my orders. I will check also the paperwork on the patient to make sure that I know their activity level. I also look in the paperwork for any type of allergies to iodine or latex. I will collect my materials. I will knock on the patient's door, and I'm looking for Jim Rose. I will come in, perform hand sanitizer, close the curtain, introduce myself. Hi Jim, I got my paperwork in hand. I will put his name and his armband to him and ask him to spell his name and his birthday. Thank you, Jim. I will also explain why I am here, which I'm sure you can probably figure it out because I'm sure he's got a distended abdomen. I will elevate him to a comfortable working height. I will also put on adequate lighting. Keep coming, buddy. I will answer any questions that Jim may have. Buttons are touchy. I'll lower the guardrail. I will expose. And I'm going to do a slight abdominal assessment. I will pull back only the area that I need to look at, and I'll start from his lower right quadrant and just light palpation. Feel. Look for distension. Make sure that his navel is midline, which everything is. He's got a little bit of distension, which means he's probably got a full bladder. I will then recover him so as not to expose. I will also ask Jim to put his legs nice and wide. I will put down my pad because I will begin to start cleaning Jim for the procedure. I'll ask him to lift his buttocks if you can so I can get this under him more. Thanks, guys. I have my warm soap and warm water, and I'm going to start cleaning, beginning with the tip of the penis in a circular motion and working down the shaft. Get some nice warm soapy water. Ish. I'll firmly grip without making eye contact. And just slowly work around, working down the shaft. Rinse. And I'm going to do it again just because I'm a guy and I feel it's necessary. Around. Around. Okay, I will then throw that in the laundry. I will take my other towel. I will use this to dry him. In the same circular motion. In a firm way so as not to excite. I will then get rid of all my stuff. Cover him again. And then open up my sterile field. Throw this in the trash. Have my sterile equipment. This will also be used as my trash receptacle. I don't think they can make these bags any smaller. I will open up my field. First going away from me. I'm actually going to perform hand hygiene again just because it's good practice. Then to my side, to my other side, I'm going to rotate and then pull off the other side. I'll take away my fenestrated because I'm not going to use it. And usually I would just drop it, but it's not big enough. Grab my pad. I want to take it and have the shiny side down. I will also pull this back and slide this under Mr. Rose just for another layer. I will then slide and grab my gloves, open them up,
well, at least now I know where
put Put on my dominant hand first. And for some reason this thing just wants to keep flapping back. Hitchhiker's thumb. And that's enough for that. I'm going to rotate my table. Slide. I'm going to get everything set up. There we go. What I'm going to do is I'm going to pull out my specimen container with the sticker, put it on my field. I'm also going to take my lubricant. I'm going to actually spray it or push it into my container, my holder. Discard this. Okay, I'm going to put everything back in. Center, pick up, and I'm going to place it right in between Mr. Rose's legs to get ready for the catheting. So I'm going to clean him with iodine swabs, pull open, throw away, take the first swab out, and this is now going to be my dirty clean hand, this will be my sterile hand. I'm going to grasp Mr. Rose and just swoop, throw, take another stick, swoop, in a circular motion, throw, swoop, and throw. Mr. Rose is now clean. I will take my straight cath without touching it with my dirty hand. Make sure that there's going to be enough space to get into my container, and with the lubricant 1 to 2 inches up, I will firmly grasp Mr. Rose without making eye contact and start inserting slowly until I get urine. And then there goes my sample. And I will keep going, letting him go until there is no more urine coming out. I will then ask Mr. Rose to cough as I slowly pull this out and wrap it around my hand. Let go. I will then throw this away. I will then don another pair of clean gloves. Actually, I'm going to perform hand hygiene just because I took off a pair of gloves and it's probably good practice. I'm going to pick up all my materials now. Set this on his table without any of his personal belongings there so I can take my measurement later. I will take a clean, soapy washcloth to wipe off all the iodine in a circular motion, again grasping and just going around. Throw it in the laundry. Take my other towel to dry them off. Again grasping and going somewhat rough so as not to excite. So now Mr. Rose is clean. I will remove all my other materials. Throw it in the trash. I will then cover Mr. Rose. Putting him back to a comfortable position. Trash. Cover him. Gloves. Raise the bed, or raise the railing. Lower the bed. Talk with Mr. Rose about the procedure, if there's anything else that I can do for him, if there's any pain, or whatnot. Okay. I will now don another pair of clean gloves, performing hand hygiene. I will take his specimen to his bathroom. Pour it in a graduated cylinder. Make the notation in his document, and then I will also take at least 10 mLs of the sample to send down, because I guess that is what we need. I will then discard the unused urine in the toilet, flush, discard of all my equipment, and then document in the book what was done. This is my straight cat.